Sinusitis, sinus infection. Sinusitis is swelling of the sinuses, usually caused by an infection. It's common and usually clears up on its own within 4 weeks. But medicines can help if it's taking a long time to go away. Check if it's sinusitis. Sinusitis is common after a cold or flu. The main symptoms of sinusitis include pain, swelling, and tenderness around your cheeks, eyes, or forehead. A blocked or runny nose, a reduced sense of smell, green or yellow mucus from your nose. A high temperature. Other symptoms include a headache, toothache, bad breath, a cough, a feeling of pressure in the ears. You may also snore at night and sound nasal when you speak. Young children may also be irritable, have difficulty feeding, and breathe through their mouth. What are the sinuses? The sinuses are small, empty spaces behind your cheekbones and forehead that connect to the inside of the nose. Sinusitis causes the lining of the sinuses to swell up. This stops mucus draining into your nose and throat properly, making you feel blocked up. How you can treat sinusitis yourself. You can often treat mild sinusitis without seeing a GP by getting plenty of rest, drinking plenty of fluids, taking painkillers, such as paracetamol or ibuprofen. Do not give aspirin to children under 16. Avoiding things that trigger your allergies. Not smoking. Cleaning your nose with a saltwater solution. How to clean your nose with a homemade saltwater solution. Boil a pint of water, then leave it to cool. Mix 1 teaspoon of salt and 1 teaspoon of bicarbonate of soda into the water. Wash your hands, stand over a sink, cup the palm of one hand and pour a small amount of the solution into it. Sniff the water into one nostril at a time, breathe through your mouth and allow the water to pour back into the sink. Try not to let the water go down the back of your throat. Repeat the first 5 steps up to 3 times a day, making a new solution each time, until your nose feels more comfortable. If you have a high temperature or you do not feel well enough to do your normal activities, try to stay at home and avoid contact with other people until you feel better. A pharmacist can help with sinusitis. A pharmacist can advise you about medicines that can help, such as decongestant nasal sprays or drops to unblock your nose. Decongestants should not be taken by children under 6. Saltwater nasal sprays or solutions to rinse out the inside of your nose. They can also provide other treatments if you need them, without you seeing a GP. Find a pharmacy. Non-urgent advice. See a GP if you have sinusitis and are very unwell. Painkillers do not help or your symptoms get worse. Your symptoms do not get better after 3 weeks. You keep getting sinusitis treatment for sinusitis. If a GP thinks your sinusitis needs treatment, they may prescribe medicines such as steroid nasal sprays or drops to reduce the swelling in your sinuses. You might need to take these for a few months. Antihistamines if an allergy is causing your symptoms. Rarely, you may need antibiotics. This is not common as sinusitis is usually caused by a virus, not bacteria. The GP may refer you to an ear, nose, and throat (ENT) specialist if you still have sinusitis after 3 months of treatment. Keep getting sinusitis, only have symptoms on one side of your face. The specialist may recommend surgery for some people. Diagnosis. A healthcare provider might ask about symptoms and do an exam. The exam might include feeling for tenderness in the nose and face and looking inside the nose. Other ways to diagnose chronic sinusitis and rule out other conditions include nasal endoscopy. A healthcare provider inserts a thin, flexible tube known as an endoscope into the nose. A light on the tube allows a care provider to see inside the sinuses. Imaging tests. CT or MRI scans can show details of the sinuses and nasal area. These images might pinpoint the cause of chronic sinusitis. Nasal and sinus samples. Lab tests aren't often used to diagnose chronic sinusitis. But if the condition doesn't get better with treatment or gets worse, tissue samples from the nose or sinuses might help find the cause. An allergy test. If allergies might be causing chronic sinusitis, an allergy skin test might show the cause. More information: allergy skin tests, CT scan, MRI. Show more related information. Treatment. Treatments for chronic sinusitis include nasal corticosteroids. These nasal sprays help prevent and treat swelling. Some are available without a prescription. Examples include fluticasone, Flonase allergy relief, Exance, budesonide, Rhinocort allergy, mometasone, Nasonex 24HR allergy, and beclomethasone, Beconase AQ, Q-Nasal, others. Saline nasal rinses. Use a specially designed squeeze bottle, Neilmed sinus rinse, others, or neti pot. This home remedy, called nasal lavage, can help clear sinuses. Saline nasal sprays also are available. Corticosteroid shots or pills. These medicines ease severe sinusitis, especially for those who have nasal polyps. The shots and pills can cause serious side effects when used long-term, so they're used only to treat severe symptoms. Allergy medicines. Using allergy medicines might lessen allergy symptoms of sinusitis caused by allergies. Aspirin desensitization treatment. This is for people who react to aspirin,